Welcome to the module Assessing Transition Readiness. This is the fourth of 10 modules. By the end of this module, you will be able to discuss the importance of transition readiness assessment, administer assessment tools, and use assessment worksheets with patients and caregivers. Assessing transition readiness incorporates concepts discussed in the previous 3 modules, including the transition stages and working with parents and caregivers. Recall the 8 steps of the transition process supported by the Joint Statement on Transition, the 6 core elements, and the Florida algorithm. The first 2 steps describe assessment concepts. They are key to all subsequent transition activities. Assessing transition readiness lays the foundation for all subsequent planning and activities involved in the healthcare transition. A patient's knowledge about their disability is paramount to independently managing their condition. Equally important is knowledge of good health habits such as diet, exercise, and sexual health.
I think I would certainly tell them to try to do it as normal as possible, without regard for there being actual healthcare issues. And then after you've addressed the issues that you need to do normally, then go back and kind of look at, okay, what else do we need to add on to this? And like, for instance, going away to college, the first thing I was going to take care of is, where did I want to go? And I didn't consider, how far I'd be away from my doctors. I didn't consider any of that. I just considered, what's going to be the best plan for me getting to my goal, which is to be in the airline business. And I went to a school that accommodated that, probably the best in the country. So I found out what school I wanted to go to, made sure I got into that school, and then I addressed some issues like, where was I going to live at school, what was I going to do for money, how was I going to pay for college, things we all have to decide, things we all have to address. And then once all that was figured out, and I made sure I could actually go up and do it, then I started to worry about, well, how am I going to be able to do it with these extra set of issues. So, living in an unair-conditioned dorm for, the 3 hot months that I'm there at school wasn't going to be workable. So I had to add on that issue. I had to go get air conditioning and put in my dorm. And it wasn't that difficult to make a few phone calls. And, I had to schedule my physical therapies. So I definitely say when you're looking to transition, make sure you got all the basics down. Don't worry about any of the other stuff until you're sure you can do what everybody else has to do. And then add those other things on.
A group of experts in healthcare transition, including Dr. David Wood at the University of Florida College of Medicine, Jacksonville, developed the TRACK. Dr. John Reiss at the Institute for Child Health Policy, University of Florida, developed the 3 planning guides. These tools identify the steps to independence and a successful healthcare transition. The Transition Readiness Assessment Questionnaire, or the TRACK, and the Transition Planning Guide worksheets are the recommended transition readiness assessment tools. They both have separate sections for patients and for parents and caregivers. TRACK is a validated, patient-centered questionnaire to assess youth's healthcare self-management skills and knowledge. It is self-administered and takes less than 5 minutes for youth to fill it out. TRACK is available in an Excel file to input, score, and aggregate results, or in PDF. Take a moment to review the response options on the TRACK. These provide a range of responses, from no knowledge to complete mastery of skill. The TRACK consists of 20 questions that assess the patient's skills within 5 categories. It is important to emphasize with the patient that the document, as a whole, is meant for patients 12 to 21. Some activities will be age-appropriate for the patient and others will not. Complete the assessment during an office visit. Review and update annually. In the next module, we will discuss using assessment results to make the patient's transition plan. In keeping with the shared management model, the patient is the TRACK's target audience. Emphasize that there is not a right or wrong answer. The assessment simply takes a picture of the patient's current task completion. The 3 planning guides are age-specific, separated by the 3 transition stages. They include assessment worksheets for patients and for parents and caregivers to complete at home. The worksheets present an opportunity for patients and caregivers to engage in dialogue about transition and to think more comprehensively about needs and future plans. Thinking about the future asks a series of yes and no questions and has checkboxes. This information provides youth and families with a context for healthcare transition. Questions are grouped under the headings of school and work, living arrangements, and planning. Pages 23 through 27 of the guide provide worksheets on healthcare independence using the remaining 7 areas of healthcare transition. Envisioning a future is a critical first step in the long-term process of transition. The Transition Planning Guide asks a number of questions to start this process. Planning Guide 2 follows a similar format to the first guide, with added emphasis on the youth's new responsibilities and their self-efficacy. The first 2 planning guides for youth have only 2 sets of worksheets, Thinking About Your Future and Healthcare Independence. Parents and caregivers complete the other 2 sets of worksheets. In the previous 2 planning guides, the Transition Plan worksheet appeared with the parent or caregiver worksheets. In the final guide, the Transition Plan worksheet is part of the youth's activities. This reinforces the idea that young adults now have the lead role in directing their care. The next few slides discuss using TRACK and the planning guides with parents and caregivers. Parents and caregivers' input is important during assessment. The TRACK provides a separate set of directions for parents and caregivers. Ask them to fill out a separate form rather than complete it for the patient. The first 2 planning guides for youth have 3 sets of parent worksheets, Thinking About Your Child's Future, Parents' Healthcare Transition Activities, and Transition Plan Family Worksheet. The questions in this worksheet for parents correspond to those in the worksheet for youth. For example, my child will finish high school on page 5 matches. I plan to finish high school on page 19 of the youth worksheets. This section appears in all 3 guides. It assesses the caregiver's transition preparation activities with the patient. Children with significant physical limitations may not have a goal to complete activities independently. Their ability to direct others, for example, a personal attendant, is a more appropriate goal. Therefore, both options are presented in the parent and caregiver worksheets for the age of responsibility. Even at the age of transition, the planning guide provides questions for the parent or caregiver to answer about their expectations. The questions address key activities that support their child's independence, including those for early transition related to insurance, SSI, and vocational rehabilitation services.
Experience going away to college, it was very exciting, yet very nerve-wracking at the same time. I think you have to understand that the only time I had really been away from my family before that for any length of time was at a summer camp, and for not even a week. So going away to college was such a big transition for me.
Yet there was still the concern that Jeff was being cared for the way that he was cared for at home. It was easy to do it. Jeff made it very easy to do it with the smile that he had on his face when we drove away from Keene State College. When we called the next day and he was too busy to talk to us, we knew that it was the right thing to do. And seeing him and seeing how happy he is and seeing the things that he's accomplished at school, you knew that it was time to let go.
I've wanted to come here since I was a sophomore in high school. I think the campus is very handicap accessible, which obviously for me was one of the primary factors in considering any college. A little story behind that, my mother was involved in a parent support group when I was in high school. And for one of their meetings, they had several disabled student coordinators come and speak from various colleges. And the coordinator from this college, Jane Warner, came to speak, and I really was impressed with what she had to say.
Students with more medical and physical disabilities, the important piece is to really work with the student up front in regards to what those might look like. I know when we were working with Jeff, he came prepared with lists of questions that he had, and was really upfront with us in terms of what he might need for assistance early on and how would we problem solve around that, from the note-taking, eating, and some of his personal care issues. There was a lot of consideration around that.
A big part of that preparation came from the Independent Living Center. Their social worker there provided various training for Jeff and us too.
Jeff requires total care for everything that he does, feeding, dressing, bathing, having his clothes put on. I mean, there's basically very little that Jeff can do because he has such limited use of his upper extremities.
That is definitely frustrating at times. But on the other hand, I've come to terms with that, and I realize that that may never change, and that's just something I have to live with. I mean, I'm not going to let it stop me from achieving my ultimate goals.
So now he gets care at school, but it was learning how to manage that care. And again, it was supporting Jeff through the earlier years, and then again throughout the summer before college began, of planning out what the attendants needed to do, of working through the Independent Living Center and being trained on how to hire personal care attendants, how to fire personal care attendants, how to handle conflict, and how to best do all of these things.
I think you're getting better at it.
I think so. I'm not as afraid anymore of breaking your arm.
Ryan just does it, she doesn't care anymore. In terms of my personal care, while it's pretty easily managed now, it wasn't always that way. Let's see. If you could put the C book in my, not the one that's out, the other one.
Yeah,
The one that's out is mine.
The next few slides discuss how to introduce and administer assessment tools in your practice. When introducing the assessment tools to patients, build off of your initial transition conversation. Remind patients and parents and caregivers that this process is for every adolescent in your practice. Each patient should start with assessment tools for Stage 1, regardless of their age. The Florida Algorithm for Youth with Special Health Care Needs highlights transition readiness assessment beginning with the age of responsibility. The Florida HATS Toolkit includes TRACK as PDF with a separate scoring guide. Earlier slides provided examples of that format. The toolkit offers an alternative format of the TRACK as an Excel file to input, score, and aggregate results, seen here. The planning guides are lengthy. To avoid overwhelming the patient or the parent or caregiver, advise them to break the worksheets into smaller portions. Patients and parents and caregivers should complete their worksheets independently outside of appointments. These worksheets support the in-office TRACK assessment. Module 5 will discuss the transition plan worksheets. The guides are organized developmentally, with all patients start at the first transition guide, building with the patient's abilities year by year. If a child is unable to use the planning guide, support parents' worksheet completion. Include the patient in this process to their fullest capability. Take a few moments to review the questions on this slide. The slide will advance in 1 minute, giving you time to write down your response. Before closing this module, we will examine additional resources. In 2014, the National Center for Healthcare Transition Improvement released a new transition readiness assessment tool, similar to the TRACK, that matches each domain of the 6 core elements. The Illinois Transition Care Project offers 4 assessment tools. The first is a patient transition readiness assessment for use with the pediatric provider. The second is a patient healthcare skills assessment for use with the adult-oriented provider after the care transfer. The third is a parent and caregiver transition readiness assessment for use with the pediatric provider. This tool is specifically geared for parents and caregivers of patients who anticipate a guardian or healthcare surrogate after turning 18. The fourth is a legal guardian's healthcare skills assessment for use with the adult-oriented provider after the patient's care transfer. Assessing the patient's transition readiness is an annual activity that should begin at age 15. The planning guides for youth and families, which can be completed at home, support in-office administration of the track. All patients should begin at the first stage of transition and with the first guide. Use the links from this course's toolkit to access the resources from this module. The next module demonstrates how to use assessment results to address patients' gaps in knowledge or skills. You can pause here for a short break or continue to the next module.